אנו מכריזים בזאת על הקמת רדיו BGU באוניברסיטת בן גוריון בנגב.
Good afternoon, or it's the afternoon for us, ladies and gentlemen. Very nice to be here again. I'm delighted to welcome my friend and colleague, Professor Mick Alkan from BGU, Ben Gurion University, and Soroka Hospital, and many other places. He has a very, very interesting life story and career story, and he's a very accomplished person. He'll tell you about himself, but I'll tell you what I know about him. And that is that he was born in Israel and grew up in Tel Aviv, I think. He'll correct me if I'm wrong. Went to medical school at Hadassah, that is correct?
Yes.
And then later on did his residency in internal medicine and also in infectious diseases, and has been on the faculty at Ben Gurion Soroka for many, many years, and retired because we have these crazy mandatory retirement laws a few years ago. But being the person he is, and you'll hear much more about him shortly, he is the most unretired person I know. He's very busy. So welcome, Professor Alkan. Mick.
Thank you very much. Thank you for having me.
Pleasure. So just tell us, even though I've given a very thumbnail sketch of your career, in 2 or 3 lines, tell us just a bit about your training, where you did it. Did you do a fellowship? Sort of what, just a little bit about your background, training in medicine. We'll get on to other things shortly.
I studied medicine at Hebrew University, Jerusalem, which was at the time the only medical school in Israel.
Some people think it still is, but that's another story.
I know. Others think Beersheba is the only place on earth.
That's what you and I think, but...
Right. And I was a resident in internal medicine at Hadassah after being an intern in the very small community hospital in Beersheba. 350 beds. Just to give you the gist of it, at lunch in the staff cafeteria, the cook used to come out and ask if anybody wants more because maybe someone is still hungry. It was a family atmosphere.
Yeah, very sweet.
And it was I made the best friends. And then I decided not to be the head of the foxes, but to be the tail of the lions. And I went to Hadassah for my internal medicine residency, followed by military service, which was a compulsory service with a little tail of 20 years of regular officer in the Israeli Defense Forces, and then another 20 years of reserve. So this was my side job. What I really did was I did a fellowship in infectious diseases at the University of Tennessee, and spent some time doing research at Wayne State and at UCLA and at Beth Israel in New York. So this is actually what made me as a specialist in infectious diseases.
Right.
All along, I was more interested in people than in diseases. And my big craving was healthcare for the underserved, healthcare for the underdeveloped. And I really, I did a lot of things, even if I say so.
We'll come to those in the next hour, but that's a good introduction. What you say about your interest in people, I can attest to the fact that you're a doctor who doesn't just care about the person's disease, but the person with the disease. And I wish there were more like you. Something that I've always found interesting about you, because I'm so bad at it and you're so good at it, is just tell us briefly how many languages you speak fluently.
Okay. I speak equally well Hebrew, English, and German. Not so well Arabic, French, a little bit of Spanish, and I can add Yiddish to the list. I can examine a patient and take a history in 2 or 3 other languages, in which I can say, please take a deep breath, and I can say, where does it hurt? Right. And these are Russian and Italian and others. But the moment the patient answers, I don't understand what he's saying.
Well, I'm usually in that situation,
Yeah.
but you're only in that situation in a few of them. How important do you think it is for doctors to have your linguistic skills, or at least aspire to speaking more than one or two languages?
In Israel, it is
Yes.
absolutely critical. And I'm not such a good doctor, but I can speak to many of my patients in their own language. Even if it's 5 words in Amharic, it opens the door. It really makes a difference.
Yeah, I agree with you. Well, that takes us to your, just tell us a wee bit about your father. You've told me about him before. He sounds like an interesting person. If I recall, he's what we call a yeke in Israeli slang.
That's right.
German,
My father, my father had the unfortunate luck of living in interesting times.
Yeah.
He was born in 1911 in Berlin and couldn't graduate medical school in Berlin because of Hitler. And he finally graduated in Prague in Karl's University, which is a German language medical school.
And then when did he come to Palestine or to Israel?
1935, a week after graduation.
He was a Zionist. He ran away.
He was a Zionist. He was a Zionist. My mother was not, and she, to her last day, said, "I came for love of a man and not love of a country," in spite of the fact that she loved Israel dearly.
Right. And who died first, your mother or your father?
My mother died at a relatively early age, and my father volunteered in the British Army in 1939, and actually had a difficult time convincing them that he's not the enemy because he was carrying a German passport.
Right. Yes, there was lots of stories like that, about the German Jews who were running away. Yeah.
He opened the passport on the right page and showed them the purple huge J that was stamped in.
For Jude.
Jude, yes.
Yeah. Okay. So did your father have any influence on your decision to become a doctor? Do you think that influenced you in any way?
It certainly did. I was a rebellious teenager, and
you're a rebellious 70-year-old now. So what else is new?
I know.
You never really grew up, I think.
So I sat in his office. I sat there and I said, "What's so special about being a doctor?" And there was a moment of silence, and then he said, "Man kann Menschen helfen." You can help people.
Right.
And that actually was what convinced me. And if I go very, very fast forward to the last month, with this corona epidemic, I tried to volunteer at Soroka Medical Center. And at first they said, "You're in a risk group, you'd better not volunteer here."
Yeah.
And then more than 200 members of the staff of the hospital have been infected with corona, with the COVID virus.
Right.
And it's a handful to take care of them because they have a variety of late effects, many of them physical, others emotional. So I volunteered and opened a phone clinic in which I speak to each and every one of them. And believe you me, I'm not making a difference in their health care. I'm making a difference by saying, "I am Professor Emeritus in infectious diseases, and I want to know how you're doing." And follows a 10-minute.
I'm sure you're helping them a lot if, from the health point of view, that you're open. I'm translating from Hebrew, an ozen kashevet, a listening ear.
Absolutely.
But you're more than that, Mick, because you're a doctor, so you can understand and advise more than just a friend could, for example.
That's right. And if someone says, "I have difficulty in keeping my balance when I walk," I make sure that this person is seen by a neurologist ASAP.
Right.
So yes, there is a clinical aspect, but the major difference is that I speak to the people.
Yeah, and you can speak all these languages, as we've already established. Okay, well, let's move. You've alluded to the fact that you've always been interested in working for underprivileged people in underprivileged places. And that's when I first met you, working for, teaching in the Medical School for International Health, which is Ben Gurion University's excellent medical school that specializes in the theme of global health. So how did you first get involved in global health?
I was a medical student, and we had to take 1 month of an elective with a family doctor. And I chose the late Dr. Benjamin Benassa, a Dutch Jew who worked for the Ministry of Health, and his equipment was a jeep, a box of medications, another box of files, and he took care of the Bedouin in the Negev. This was before there were Bedouin towns. We used to spend long hours in the jeep.
Sounds fascinating.
And he was a genuine, true to style general practitioner. I'll just give one tiny example.
Please.
One of the misunderstandings between the family and the doctor among the Bedouin was that it was traditional to remove the uvula, that little
things that hangs down from your throat,
from your throat, in the newborn, because then the newborn will not have tonsillitis ever, which of course is wrong.
Right.
And then some kids bleed and
get infected.
And it's done with a pair of scissors, which is not sterile. I mean, all the wrong things.
Right.
So Benassa used to take a baby, open the baby's mouth, and take an applicator with gentian violet, which is a raving purple color, and smear it on the whole palate of the baby. Show the grandmother and said, "This is how we do it in modern medicine."
I see.
Instead of cutting.
This prevented them. They were satisfied that the act was fulfilled the functions of their surgery, but it didn't do any harm. And it
was
full of color.
And his special interest was hypnosis, and he used to hypnotize Bedouins with acute asthma attack and make them breathe freely.
Wow.
He was an amazing doctor, doctor.
Yeah.
And what he really taught me was that it is not about the most modern methods and about knowing the book by heart. It's about understanding what the people need and providing that under circumstances which were far from ideal.
Right.
And that was formative.
Okay, well, that's a great story, but it doesn't answer how you got into global health, because what you're describing is a good doctor who happened to find himself in the Negev. But from the point of view of global health, going to underprivileged countries and underprivileged peoples, what was your first experience that hooked you onto that? Clearly, your background, your training, your experience with the Dutch doctor influenced you, but what was the first gig you had outside of the country that we would classify as a typical global health experience?
The first big gig was courtesy of the Army. Okay. The Army organized a thrust, which was actually initiated by the government. 1980. Cambodia was in shambles, and there was 1.6 million refugees who crossed the border into Thailand. They were in terrible refugee camps, and Israel sent a team to work in a makeshift hospital run by the UN and the International Red Cross. I was asked to organize the group and run the operation, and we were asked to hold the admissions and emergency. We were inside a refugee camp, and we were the only team that kept 2 out of the 10 every night, so that in the camp, so that we were manning an emergency room 24/7.
Good for you. Right.
And that was absolutely amazing what we could do there. I interviewed each of the members of the team, And I really had a team of angels. I mean, it was unbelievable. Everyone was grabbing for more work and more commitment and more to do.
Encouraging these days of selfishness and narcissism to recall such a scene.
And I must have chosen the right people, because one of them eventually became dean of our medical school.
Who is that?
Shaul Sofer.
Right.
And another one became the academic coordinator for the School for International Health and Medicine, Yaakov Henke. He came and really begged me to take him, and I said, "Look, you're just through with your medical school. You have no experience." He said, "I'll go as a medic."
Yeah.
You need a medic. I will go as a medic.
He'll do anything. He's like that. He's a fine fellow.
So some of these people really developed their career beautifully afterwards. So
good for you. You obviously love this, and you told me stories recently. One of your more recent gigs is a kind of dreamboat experience in Papua New Guinea. Why don't you tell the listeners a little bit about that? Because that goes from being in a refugee camp surrounded by mosquitoes and eating out of tinned food onto a kind of luxury boat where you did a lot of good, I know, but still a different kind of experience. Tell us a bit about that, please.
It's very interesting that you compare the two, because we rented a house in the village in Thailand outside the camp.
I see. And
the lady of the house was cooking for us home Thai food. I have never eaten as well as I have there. It was unbelievable. And the ship I'm going to tell you about, we had a Swiss cook, and the ship gets provisions once every other week when it's in the port. So the whole outreach of 2 weeks on board, you can imagine what the tomatoes look like on day 12.
After 2 weeks, yeah.
So and he had no imagination, no sense for spices.
Better to be in a refugee camp in Thailand than a luxury boat.
Absolutely, yes. So let me tell you a little bit about
Tell us about that
Papua New Guinea thing.
Tell us where. Not everybody even knows where Papua. I do, but because of you.
Okay.
Just tell us where
Papua New Guinea is. If you want to go to the most remote place on earth, go to Papua New Guinea.
Okay, so it's remote.
It is somewhere north of Australia, in the middle of the Pacific, and it is made up of over 1,000 islands. They speak more than 170 languages, and the nation is about 8.5 million people. So every 2 people have their own language, because they live on an island which is isolated from the rest.
Right. Like Darwin's finches, linguistic finches.
Yes. And there is a very Christian organization called YWAM, Youth with a Mission. The acronym is YWAM, who purchased a pleasure ship, a ship that was cruising in the Pacific. It's a huge catamaran, and they refurbished it so that it can act as a hospital ship. And they're very smart. This NGO made an agreement with the Ministry of Health of Papua New Guinea, asking them, what do you need? And they said, we want to improve mother and child care. We cannot provide dentistry in all the islands. We cannot provide eye surgery for the people who go blind with cataracts. Adding to that general practice and optometry, this is what the ship provides. So it has 2 operating tables for cataract. It has 4 dental chairs, and it has 3 multi-professional teams that go on Zodiac dinghies to villages every morning, to a different village to run clinic. And again, it is an absolutely amazing experience. There are 130 people on board, very Christian, very religious, in an open way. Never in my whole experience have I been approached and asked, how is it that I don't see the light? So they don't proselytize, but they give an example by personal commitment, which is so beautiful.
Service.
Yeah.
What's the most interesting case you saw there? If you could, or among the most, what surprised you in Papua New Guinea medically?
You know, the big surprise is that there is no surprise. When I was in Botswana and the man was admitted with deep cuts in his thigh, and he said that I was scratched by a lion in protecting my cows. That amazed me. I mean, that was totally unexpected.
Yeah.
But children with bronchitis, infected wounds that were made worse by a tropical sea, this is not a surprise.
Mm. Right.
What I tried to do there was really to teach the young stuff, which came from 17 different countries, and really pass any of my experiences and share what I know. And I'll just give one example. There was a tiny hospital with a German surgeon where we stopped, and they asked me to make rounds with him, and he was performing surgery and had no access to pathology.
Wow.
So
just explain what that means. We don't have a non-medical. I know what you mean, but to the non-medical
what I mean is the doctor performs surgery, takes out a specimen, and cannot put it under the microscope
analyze it. Can't analyze it.
What's there.
It may or may not be cancer. It may or may not be TB.
Exactly, and particularly lymph nodes are the culprit.
Right.
And there, TB is a major issue, but lymphoma is also a problem.
You know that Thomas Hodgkin, excuse for interrupting, but Hodgkin's disease, they looked at the 7 lymph nodes that's sitting in the museum in London, supposedly Hodgkin's disease. 2 of them are tuberculosis. Yes. So go ahead, I interrupted.
So I went to the laboratory and asked what the capacity was in general terms, and they could do 3 different stains. So I taught them how to slice a lymph node that was taken out, imprint it on a glass slide, on 3 glass slides, and stain it with all 3 stains. One was a stain for tuberculosis. One was a stain to identify cells which are not the right cells. And one was to identify if there is a bacterial infection in there.
So you may have saved many, many lives by teaching them how to do that. Yeah.
I hope so. I hope so.
Good. Yeah. Okay. Let's move away from Papua New Guinea. You've been to many, many countries. I won't test your memory by asking you to tell us all the countries, but I understand that you spent some time in Somali-land, which is on the Horn of Africa, sort of surrounding Ethiopia and Eritrea, not really very far from us from a geographical point of view, but far from us in the sense of understanding, having any knowledge of. All we know about, if someone would know anything about Somaliland today, they might say pirates, the pirates of Somaliland. But correct. How did you get there, and what were you doing there?
I was approached by one of the old soldier friends of mine who, after being discharged from the army, started to develop projects in Ethiopia. And I visited him in Ethiopia several times when we developed our relationship with different medical schools in Ethiopia. I was teaching in Gondar, teaching in Mekele.
Right. The cities that are at war right now, unfortunately.
That's correct. Yeah, and he said, I want you to come with me. I am developing a project in Somali-land. And I responded just like you did. I said, where the hell is Somali-land? And he assured me that it's safe and that it's nice. And just the word Somali made me wonder if this is the right place to go.
Right.
Anyway, there were flights from Addis Ababa to Somali-land. And it turned out that this is a self-acclaimed state or country, if you want. They cut themselves away from Somalia, printed their own money, printed their own passports, and nobody in the world would recognize them. Just to give you an illustration, if you go to the market in Hargeisa, which is the capital, the merchants have big boxes to hold the currency.
Because of inflation.
Because of inflation, yes.
Right.
And when you want to buy something, you buy with a stack of notes.
Right.
So it's not a happy place. So
sort of like Germany when your father grew up.
That's correct.
Same hyperinflation of Germany.
That's absolutely correct. My father used to say that his father received payment from a patient, ran to his wife and said, "Go and buy some meat right away."
Yeah, before it got too expensive. Right?
Yeah.
So what did you do in Somaliland? What was
Somaliland, in Somaliland, first of all, I was the medical doctor for a team of 4 entrepreneurs who were working on developing crops and on developing fisheries. It's the Red Sea. It's
right.
One of the best fishing grounds in the world.
Right.
And I was there to take care if there's any medical problem. That's the easy part. The more difficult part was that this entrepreneur said, "I want to invest in doing good medically. Can you give me advice?" So while they were looking at water, soil, sea docks in the harbor, I was running from one medical establishment to the other. And to my amazement, there were some very fine people there, very well schooled, very bright. I must say, in general, the notion that white people have a monopoly on brains is one of the most stupid ideas I've ever heard.
Yeah, I agree with you.
Not only that, with internet, people all over the world read the same papers.
Right.
So
they know what we know. We know what they know. Right.
But their only frustration is that they can't do what we can do.
Right.
And that's the big frustration.
Yeah. But they know what we know.
I ended up writing a report about all the medical facilities in Somali-land. We spent a week there, which was completely crazy because the government was very much interested in this project. And at the end of the week, the prime minister at a dinner said to my friend, "You want us to fish, but we need to protect our fishing boats. I want you to help me with arms so that we can protect our fishing boats." And that was, for my friend, the end of the project. He said, "I refuse to deal with arms. I was in the army for 25 years. Enough is enough. I'm not into this."
Right.
Which was abrasive at the time.
Yeah.
Anyway,
they let you come there on your Israeli passport? I mean,
oh yes. There even was a quasi embassy in Addis Ababa.
Israeli embassy?
No, Somali-land embassy.
I see.
Somali-land Office of Interests, which gave me a stamp in my passport, which allowed me in.
Fascinating.
And speaking Arabic was a big help. Yeah. And the bottom line is that I published a paper on the local medical facilities in Somaliland.
No, I've never seen that. Maybe you'll give it to me. Well, you've written a lot of interesting papers. Okay, well, let's move. We can't finish this hour. Well, we're not finished yet, but we can't avoid, unfortunately, the vexed subject of COVID-19, SARS-CoV-2. And you're an ID specialist, so you're the right guy to ask. I'd ask you, the newspapers are full of stuff. So I'm not going to ask you to give us a new fact because there's, just like you said about our friends in Ethiopia, our listeners probably know what we know. They can read the internet just as well as we can. But give us a little bit of perspective. How should we take this pandemic in historical perspective, knowing what we know today?
I think that ever since the outbreak of HIV/AIDS, we have not seen an epidemic. We've seen many epidemics, but we have not seen an epidemic that had such health, political, financial, psychological impact on everybody. And it has really grown into a monster in that sense. And I think that we need a sense of proportion on one hand, and a lot of sincerity in trying to avoid infection. Now, avoiding infection, the simple things are simple and known, and everybody knows it. They just should do it, You walk the streets of Tel Aviv, I would estimate 50% of the people don't wear the mask like they should. And I can really tell you that the average age of the non-mask wearers is definitely lower than the one of the people who diligently wear masks.
Yeah.
So
young people seem to be feel that they're
invincible.
Yeah. Well, that's what being young is like, if you remember. Yeah. Well, this
Now,
word. Yeah. Go ahead.
You said newspapers.
Yeah.
One of the most irritating bits of information here is that every bit of information about an upcoming vaccine has a tremendous effect on the price of the share of that company in the stock market.
Correct.
And if you make it into page 1 of New York Times, be sure that you can become a multimillionaire as a producer of a vaccine to be.
Right.
And these are vaccines that are not in use yet. They're just barely out of the first stages of understanding whether they're safe and effective, without even being licensed anywhere except for China and Russia,
which doesn't count because they don't really license the way we do,
and they don't publish data, so we don't know.
Yes, I agree with you. These 3 vaccines that everyone's so excited about, our excitement is based on 3 press releases, not 3 articles in the New England Journal.
Absolutely. Not only that, but 2 of them are based on a technology which has never been used in humans.
The mRNA.
Yes. Yeah. We're injecting a molecule which should provoke our body to synthesize and present the antigen, the bit of protein from the virus, for our body to make antibodies against. Wow. And this is an amazing new discovery. Fantastic. But should it be experimented on 1,000 million people?
Yeah.
Not so fast.
I'm not sure you saw the news today, but AstraZeneca and the Oxford, did you see the news today? They've just reported the Oxford vaccine, which was the 3rd one to report via press release, by the way, they found inefficiencies in their reporting. They made a mistake. They made mistakes and reported incorrectly. So we're now getting corrected press releases. What do you make of that?
In Arabic, they say al-ajala min shaitan, which means hurrying comes from the devil. If you cannot rush these things.
Yeah.
You have to go really step by step. It is so complicated. And the pressure to get a vaccine before the election day in the US, to get a vaccine before the government in Israel falls. I mean, who cares about this government or that government? I want a safe and effective vaccine. Let me just say one more thing about this. Everybody speaks about herd immunity. Herd immunity in viral diseases means that a large proportion of the people are immune to the disease, and then the virus cannot infect anybody, and it just dies out. So this is herd immunity. And it depends on the length of the disease and on the infectivity of the disease. And for COVID, it's around 60 to 70% of the population that have to be immune in order for the epidemic to subside.
As opposed, just for example, like measles, which is 95%.
That's right.
Just to give our listeners some viruses require lower or higher herd immunity, and your reckoning is that for COVID it's about 60 to 70%.
Yes. Now, the studies of antibodies against COVID in populations have ranged between 1% in the general population and 10% in what we call the red towns, the places where the disease is rampant.
When you say antibodies, you mean those people who've been infected and are showing their body's reaction to the infection.
And we presume that they are safe and immune, and this is what we want.
Presume, you said.
Yeah. We don't know enough about the disease. It's not a year yet that we have learned our first lesson about COVID.
Right. Yeah.
Now, even if we have a vaccine tomorrow, we need to vaccinate 60% of the population in order to have herd immunity. That's a tremendous amount of people.
2 shots per person, I
2
understand.
shots per person. A little survey that asked for the opinion of people came up with the number of 50% of the people who will take the vaccine and 50% who will refuse. So we are far from 60%. And
Right.
you know what? If we don't do it fast, and the vaccine will be effective like a flu vaccine only for 1 year, by the time we're done, we start again.
Right.
So
Right.
it is a tremendous effort. And I haven't even mentioned the fact that the vaccine was produced in the US and it is held in a temperature of -70. And it hasn't even gone on the first ship to be shipped under these conditions of a very low temperature to faraway countries. And within the country, there is no containers that will keep this temperature, what we call the cold chain of vaccines. So when will that reach the primary care clinic, and how will it reach the primary care clinic of Dimona Bet in the desert in Israel? The logistics are unsurmountable, very, very difficult. We need a more simple vaccine, and we're far from answering the question.
I think the Oxford one that just has shown some irregularities in reporting, that doesn't have a -80 cold chain. So we're going to see different vaccines, I assume. Some will have more effect, some will be easier to work with, some will. But I guess the point you're saying is we're rushing ahead very quickly on the basis of very poor knowledge. But sometimes in emergencies, one has to do that, no?
Yes, and I am very happy to be on the sideline. I don't envy the decision makers.
As in the Ministry of Health, right?
A Ministry of Health, the government, very difficult decisions. The risks they're taking are tremendous. They need to acquire 5 different vaccines in order to have enough to cover the country.
Right.
Now, what if 4 of them are safe and 1 is not? And what if 1 of them doesn't prove to be effective? It's a mess.
Yeah. Well, as you started off in our talk today, you said the old Chinese curse, may you live in interesting times. We're certainly in the most interesting times that I can remember in my more than 70 years. I don't remember being more interested than I am now. So my question, do you think, we're living through an historic time. Do you think people should be more cognizant or aware, or I won't say exactly enjoy the fact that they're living through history, but be aware of the fact they're living through an historical time?
I'm always in favor of more information and correct information. And I think that with COVID, this really is the name of the game. And I'm afraid that a lot of our leaders in several countries don't give us transparent and clear information about everything. Partly because of political reasons, partly because of fear that we will respond wrongly. Either we will respond by saying, this is not a serious disease, let's laugh it off and go to infection parties,
Right.
Or the other end of the spectrum, we will be reclusive at home and not want to see anybody, not want to do anything. The economics will stop. And what's the future of a country like that?
Yeah,
and the truth, of course, lies between these two. You need to be rational on one hand. Look, I'm volunteering in 2 different free clinics for the unserved and uninsured in Israel. I know that they're young people. I know that they're not at a very high risk, but I never take my mask off in the clinic, no matter what. And I don't try not to touch any patient without a pair of gloves, which is really against my conviction, I'm a touch healer. I touch my patients. Now, I have to put gloves on. Which is, I'm estranging myself to the patients. I'm showing mistrust. But that's the way it has to be.
Well, my guess is, knowing you and your personality, that they can feel through the gloves and look over your mask into your eyes and still see the compassionate, kind person you are. That would be my guess. But I understand what you're saying. As a clinician, it's hard for you because you're used to a more open engagement with your patients. Well, speaking about patients, tell us, you've spent your life, among other things, in medical education. How do you think this pandemic is affecting and going to affect medical education, medical students, registrars, fellows? What's happening? What's going to happen?
The first thing is, I have to admit and not go into details, I'm a student myself, and I'm taking courses. And I'm taking courses through the internet, Zoom, and it's bloody difficult.
Right.
It's hard to concentrate. It's hard to follow. We don't have a substitute for the face-to-face.
Right.
Now that's number one. Now, maybe we still can teach physiology through the internet. Internal medicine, definitely not.
Right.
There is no substitute for the small group of 5 to 8 students going with one tutor and making rounds in the ward of internal medicine, going from one patient to the other, and each of them is a chapter in the textbook of medicine.
Right.
And is a chapter in bedside manners and in physical examination and then understanding the biochemistry behind the disease. I don't see how we can substitute that for something that goes through the internet. Maybe I'm wrong, because you know what? 10, 15 years ago, if people would have told me that my life would depend on a little mobile phone that's in my pocket, I would laugh them off. So very rapid developments in communication might surprise us and find ways, but we definitely are not in a position with the technology of today to switch from frontal seminar teaching, bedside teaching, to all Zoom and other applications.
How are you going to teach someone how to deliver a baby on Zoom?
Or take the appendix out.
Right, right. So, well, you haven't said it explicitly, but you have implied that this pandemic, like all pandemics, will rise and fall, and we'll go back to a more or less, at some point, for some reason, after a certain amount of perhaps terrible damage, we'll go back to a post-COVID world, like there was a pandemic in 1918, 19, and 20 of the flu. They must have thought in the middle of that the world was never going to be normal again, but it was. It became normal in 1920. So what lessons do you think we've derived? That maybe certain skill, maybe we've been doing certain things frontally for many years, like why should every medical school in the world have their own biochemistry teacher? Maybe there should be one super biochemistry teacher, and every medical student in the world should listen to his or her lecture. I'm not talking about bedside teaching. That clearly requires small groups. But will we see a positive influence on education in the direction that I'm suggesting?
Do you realize that Socrates prohibited his students from making notes on their slates?
He wanted them to remember.
Yes. He said, you have to keep it all in your head. You can't use your slate.
Yeah.
Okay. So we've come a long way since then. And a lot of the information is available, and available better than in the library. You and I grew up in the lap of the library. I mean, the library was our companion, that's where we spent most of the hours.
Yeah. When we weren't looking after patients. Yes, that's exactly right.
And now it's all on your computer or on your cell phone, depending on the generation. You and I are still computer people. Our kids, they don't use the computer anymore. They use the cell phone.
Yeah.
And, making rounds with young doctors. You say, I don't remember the dose of this medicine, and I might look it up. And before you say up, the student has punched it in and tells you the dose. Yeah.
Well, you mentioned Socrates. When the telephone was invented, there was a lot of pushback that this would destroy social intercourse, that this would destroy human relations. And now you and I are talking to each other over a kind of glorified telephone where we can hear each other and see each other. So, I think you're right that one shouldn't be too pessimistic, because humans are infinitely adjustable. We've adjusted to all kinds of things. And I think your point that we'll adjust to this as well is probably true, but there will be some damage done. I agree with you. I don't see in medicine, I don't see, in my view, and you've already said it, I agree with you, the ability to touch a person, to look into their eyes, to hug them, to say it'll be all right, put your hand on their shoulder. You and I are talking on Zoom right now, and as much as I know you and like you, if you were suffering or I were suffering, we wouldn't be able to reassure each other in the same way through a picture. But that's not allowing the excellent to be the enemy of the good. That's what we have, and we have to live with it. Yes. Okay, let me ask you a different question. Given all of this, if you had a medical student come to you, maybe you have, it says, Professor Alkan, I wanted to be a doctor, like, es kann Menschen helfen, how do you say it? What you said in German.
Man kann Menschen helfen.
Man kann Menschen helfen. We can help people. You had a medical student come to you and say, Professor Alkan, I wanted to be a doctor, but looking at the scene today, I don't see it. I'm discouraged. What would you say to that person, that young medical student or person who wanted to go into medical school?
It's purely theoretical. Purely theoretical. I think that people are more fascinated once there is an epidemic like this than they were before. Let me tell you one more thing about this clinic for the employees of Soroka who were sick with corona and are recovering.
Right.
My main thrust is to prevent them from going back to work too soon. Uh-huh. It's like the wounded soldier who escapes from the hospital to join the front line again.
And he's not ready. It's not strong.
And he's not ready. Yes. They have a lot of clinical symptoms, but they say, never mind. And their excuses, I can't sit at home anymore.
Yeah.
Which translated into simple language means my friends, my pals are in the front lines and I am sitting at home.
Yeah.
So, look, the only thing I can tell the student is that if you're not passionate about this, you'd better not do it. Because there's so much solace on the way. There's so many hurdles that you need to jump over. You'd better be passionate about this. You'd better really have the urge to do this with all your heart.
Be a doctor you're talking about, yes.
Yeah.
No, I think that's very good advice. So in other words, that's the kind of advice I would give someone before COVID. And you're saying it's still the right advice. In other words, if you want to be a doctor, you'll be a doctor no matter what. And if you think these obstacles will prevent you and you don't have enough of a fire in your belly, forget about it. Would that be an accurate expression of what you think?
Yes, absolutely. That's absolutely what I meant.
Okay, well, our time is starting to run out, unfortunately. It's always great to talk to you. But I want to end with, if you're willing to share, tell us, you've alluded to it already a little bit, how this pandemic has affected you, your work, your family, your hobbies. What has it done to Mick? What has this pandemic done to Mick Alkan?
Okay,
Professor extraordinaire, puppet master, linguist.
So let me tell you about my wife Yardena and me. My wife Yardena says, this pandemic is a blessing. I don't need to make excuses in order not to leave home. I love being at home. Uh-huh. I enjoy being at home. She's a painter. She started doing ceramics and she enjoys being at home.
Right.
With me, it is exactly the opposite. And let me tell you what my weekly schedule looks like. On Sundays, I go to the open clinic of Physicians for Human Rights and I take care of the unregistered and uninsured. On Mondays, I go to a clinic run by the Ministry of Health for sexually transmitted diseases, which is anonymous and free. These two clinics ran out of doctors because of COVID. And I said, I will continue, I will go, I'm needed. On Tuesdays, I'm a student from 9 in the morning till 8 in the evening.
You're a student?
I am a student, yes.
What do you study? What are you learning?
Oh my God. Tuesdays are dedicated to statistics and I am breaking my teeth, believe me.
Welcome.
It's very difficult.
It's never easy to learn statistics.
On Wednesdays, I take the train to Beersheba and I sit in this clinic talking on the phone to patients who are staff of Soroka. On Thursdays, like today, hooray, it's my free day. I sit on the potter's wheel for about 4 hours and it's fun and it's great and it's relaxation. The tension is a different type of tension. Will I succeed in making this pot or not? And on Fridays, I'm back to studying. There's courses of advanced epidemiology. And then I go to the Carmel market shop for cooking a nice dinner for Friday evening. That takes care of the week.
And you're studying statistics and things because you're doing a PhD?
Crazy enough, yes.
You're not enough of a doctor. You want to be a doctor.
No, I want to write a thesis on healthcare for uninsured, unregistered, particularly the asylum seekers in Israel.
Wow, good for you. That is a shame, isn't it, that we have these people that we don't cover? What do you think of that? What does that say about us as a nation that we've got?
I would rather not have me started on this.
It is a shame, isn't it?
The thrust of the PhD is comparing the ones who did buy health insurance to the ones who have nothing.
Uh-huh.
I will not go into all of this. It's too painful. Right.
Yeah, I hear you. There's enough pain in the world. It's sad that with small amount of resources, we could reduce so much pain.
Absolutely.
But we don't.
Absolutely.
This is not an expensive operation. But yeah, I agree with you.
Not at all.
Okay, well, it was really, as always, I always enjoy talking to you, but it was even more fun talking to you on radio because I had to marshal my thoughts and be less diffuse than I usually am. And is there anything, did you want to leave our listeners with any inspiring words? I don't want to leave us on that depressing note that we don't look after the uninsured, which is a tragedy and a crime. Tell us something positive, Professor Alkan, before I let you go.
There's just one very crucial little thing. Wake up every morning, grateful for yesterday and hopeful for today.
Very nice. Perfect. I'll remember. Grateful for yesterday, hopeful for today. Beautiful. Okay, on behalf of BGU Radio, I want to thank you for sharing an hour of your interesting life with us. And all I can do is wish you and your family health. So thank you very much, Professor Mick Alkan, internist, ID specialist, global health specialist, and Ish Eshkol, Renaissance man.
Thank you very much. Thank you for this. Thank you.
Pleasure. Bye-bye. All the best.